Hey, Jim Sinek here, President of Boone Hospital Center. I wanted to provide an update on where we're at with the COVID-19 battle that not only are we fighting here in mid-Missouri, but across the state of Missouri and the country as well as the world. I just want to let you know what Boone Hospital Center has been doing in preparation for this battle. Back in March, middle of March, the 16th, actually, we opened up a command center. I think most hospitals across the country have a command center now, and that really puts together a formal structure that allows us to have one unified way to communicate, to operate, and to really kind of coordinate our battle and our preparations for the COVID-19 fight. This is a situation where Boone Hospital Center is used to taking care of patients that have infectious diseases. So we have a lot of our policies and protocols in place. We've got a lot of heroes on the front lines who do this day in and day out, are very used to taking precautions and using what we call personal protective equipment when we take care of patients like this. COVID-19 is a little bit different in that it seems like it's more easily transmitted from person to person, and then also we don't have an immunization right now, so it's a little bit more serious as it relates to potential death. So Boone Hospital Center, our team here is taking this very, very seriously. We have really done a number of things to really put barriers in between our patients, our staff, our medical staff, and the COVID-19 virus, or the potential of getting that virus. We have really locked down visitation policies here at Boone Hospital Center. That's something we really don't like to do because we know patients like to see family members, loved ones, friends, but we just weighed the cost and the benefit of having visitors and potential carriers coming into the hospital, potentially infecting not only the patients, their other family members, but our staff as well as our medical staff. So we've really gone to a no visitor policy other than a few exceptions. We are actually screening all of our Boone Hospital Center staff and medical staff, and we started that back on March 18th. So to get into the hospital, whether you're a physician, a physician assistant, nurse practitioner, or an employee of Boone Hospital Center, or a vendor, a required vendor that brings product or supplies in that are needed here at Boone Hospital Center, you have to go through a series of questions, and you get your temperature taken, and if you don't pass all those questions and your temperature is not below 100 degrees, you're not allowed to come into the hospital. We do that really to protect, again, our patients, our staff, and our medical staff. And again, it's one of those situations where we're putting barriers in between potential carriers and the folks that are here on the front lines. We have really coordinated in terms of the CDC recommendations on personal protective equipment. You might hear people say PPE, personal protective equipment. So we've kind of kept up to date, and we continue following the CDC guidelines and recommendations. At Boone Hospital Center, and from what we know in our conversations with the other two hospitals, we seem to be in a pretty good place with supplies right now. We have a pretty significant inventory of those supplies. We've been buying up to the extent we can. The federal government, I think, has been incredible. It's been very proactive, getting supplies from FEMA down to the states, and we've had 5 or 6 deliveries now from the state of Missouri. We've had a lot of good leadership and input from our BJC healthcare system. So they have an incident command center set up as well. We connect with that command center every single day. The presidents of the hospital, we all have a conference call at 11:30 every day as well, 7 days a week. The command centers are open 7 days a week. So all information really goes through the command center. And through that process, we've been able to really put into place numerous precautionary protocols and procedures to make sure that we're going to be successful combating the COVID-19 virus. To date, we've done about 860 tests for the COVID-19 virus. Most of those tests, about 600 of those tests, have actually been done through our drive-through COVID-19 testing service that we set up back in March 18th, I guess, and through that process, including our drive-through service and the tests we've done here at the hospital, we've had about 16 positive patients. That's a little bit under 2% of all the tests we've taken, so we feel pretty good about that. In other metropolitan areas, they're having 20-30% positive tests coming back out of the tests that they're taking. So we're under 2% right now. So it tells you a little bit about the good work we've done in mid-Missouri in terms of social distancing, staying away from large gatherings, washing hands, and all those kind of basic needs and those basic requirements for preventing infections from being transmitted from one person to the other. We have 0 inpatients so far, so that's something that we're watching not only across mid-Missouri but across the nation, how many patients that test positive end up being hospitalized. And so far, we feel we've been really lucky, but we've also prepared in an incredible way. And to date, we don't have any inpatient positive COVID-19 patients, so that's a good sign. We're also seeing the curves, the modeling. You hear a lot about the modeling and what is the number of patients we're going to get, in particular inpatients, versus the number of beds that we have in terms of capacity, not only medical surgical beds, but also ICU beds. And we're seeing a flattening of that curve, which is really the whole idea behind all this social distancing and all the protective protocols we put into place and really shutting down a vast majority of the economy. That seems to be working. It certainly seems to be working in Missouri. We're seeing new models come through that show, even in the worst case scenario, the number of predicted inpatients is underneath the bed capacity we have across Missouri. We're also seeing that the number of ICU beds that are going to be required in the new models seem to be underneath the number of ICU beds that we have available. That's probably an area where it's still going to be a little bit tight in terms of ICU utilization versus ICU capacity across Missouri. There's going to be, in particular cases, where maybe the demand outstrips the capacity, but across Missouri, and I think across mid-Missouri, we're in a lot better shape today than we were even a week or 2 ago. And again, I credit that to the hard work that we've done across the country, across the mid-Missouri area and the state of Missouri in social distancing, washing hands, making sure that we're adhering to protocols as we work in the hospital, shutting down visitation to the hospitals. All those kinds of things have really helped combat this COVID-19 virus. The other thing that we're doing here in mid-Missouri, which I think has worked really, really well, is we're working with our colleagues at MU Health and at the VA hospital. We actually have weekly conference calls, and we talk about our capacity at each hospital, whether it's bed capacity, staffing capacity, supplies. We coordinated communication, we coordinated operations in terms of when we suspended all elective procedures. That's another strategy that you've seen put in place across the country, where hospitals have pushed off 8 or more weeks into the future procedures that don't necessarily need to be done now. They're not urgent or emergent, and the health of that patient is not going to be negatively impacted by delaying that procedure. That has opened up capacity, and it's also, again, another barrier that we put into place so more people aren't coming into the hospital that don't necessarily need to be in the hospital. So we worked with MU Health, we worked with the VA hospital to coordinate when we all really kind of ramped down on those elective procedures. We are connecting all of our command center chiefs, section chiefs across all 3 hospitals so they can coordinate things like labor pool, or they can coordinate things like overnight accommodations for our staff. We have the ability now to have staff stay at either a dormitory on the University of Missouri campus or the Stevens College campus. We've worked with those organizations. They've been incredible partners of ours, and they've opened up their dormitories for our staff, our medical staff, and we're even planning, should the need arise in a major surge of COVID-19 patients coming through, an opportunity to use some of those dormitories for observation patients or COVID-19 patients who really don't need to be in the hospital but really don't have the support structure they need at home. So we have planned on, and we do have in place the ability to take care of those patients outside of the four walls of Boone Hospital Center or MU Health or the VA. So I think you're seeing organizations coming together, working hard to make sure we have plans in place, not only today, but plans should this surge continue to grow or should it reach its peak. People are really kind of concluding that the apex of that curve will probably come through mid-Missouri in the next couple weeks. So far, we feel really good about what we've done, and I think we're very, very well prepared here in mid-Missouri for the wave that we think is going to come through over the next 2 to 3 weeks. So I do want to thank the Boone team for the incredible work they've done, the command center and the structure and the processes that they have put into place. The community has been incredibly supportive. They've donated food, they've donated the supplies, they've just done an incredible number of things that have kept the spirit of the Boone Hospital Center team sky high. I've seen nothing but positive teamwork, camaraderie, and really a genuine, outstanding, excellent, really approach to fighting this COVID-19 battle. And I couldn't say enough about the teammates that I work with here and how proud I am of what they've done. And frankly, what we've done across mid-Missouri with the other hospitals and with the community to prepare ourselves and to really put ourselves in a position that we have been able so far to slow down this virus and hopefully defeat this virus in a fairly short amount of time. So thank you, and thank you for your support for Boone Hospital Center.